Hello, dreamers of all ages, and welcome to Catch Us at the Castle.
I'm Steph Sweets.
And I'm Ed Pizza. You can catch us at the Castle. And in a more recent trip, we're dealing with the fact that we've learned that Stephanie had a collapsed lung walking around Disneyland, which probably explained a lot to you about how you were feeling and why you were feeling that way. I think the easy first question is, why did we want to talk about this on a show?
Yeah, there's a lot leading up to this collapsed lung that I had at Disneyland. And so I wanted to talk about this and share a little bit about my experience just to help people understand and bring some awareness to an illness that is not widely known and not as widely known as it should be, especially for anyone living in or visiting the southwestern area of the U.S. So I am hoping to bring some more awareness to this, especially as I'm hearing of more and more people that are struggling with this illness.
Yeah, and I had heard of the illness, but I'll be honest, I didn't know what it was other than knowing it was a legitimate ailment. But maybe a good place to start would be to talk about what symptoms you were experiencing while you were in the park that led you to think that you were having an issue.
Yeah, I think maybe we even need to back up a little bit further to what was happening to make me think and understand that I was sick, because I started having symptoms a long time before I ended up with a collapsed lung in the park. I had last August, at the end of August, started having a cough that I couldn't get rid of. And I, after a week or so, like you do, 7 to 10 days, 2 weeks, you go to the doctor and they told me that they thought it was upper respiratory infection. Fast forward, after 3 rounds of antibiotics and steroids, I decided to demand a x-ray because they told me that they wanted to put me on another round of antibiotics and steroids because they thought that it was communicable pneumonia. And so I demanded an x-ray. When they did the x-ray, the doctor came back in and said, you have a large cavitary lesion in your lung and you need to go to the ER immediately. And she said, you either need to tell me you're going to drive yourself or I will call an ambulance. Which do you want to do? I said, I will drive myself. This is fine. And she said there are only 3 things that cause cavitary lesions, and that is cancer, pneumonia, or not pneumonia, cancer, valley fever, or tuberculosis. And so I headed off to the ER knowing that I had one of those 3 things and hoping that it was valley fever. And that's exactly what it turned out to be. So I was hospitalized and treated on antibiotics at that time, or antibiotics and on antifungals, because I had pneumonia that was caused by the valley fever as well. So that was right around Christmas time, right before Christmas. And then I was hospitalized again between Christmas and New Year's for some additional issues that I was having related to it. They told me I just needed to take the antifungal for 3 to 6 months and I would be fine. I was not fine.
Yeah, well, that's definitely, knowing the end of the story, I would agree that's true. And, certainly, it's a long time to deal with sort of this underlying condition, 3 to 6 months of antifungals. But, maybe take a step back. As you mentioned, valley fever was your diagnosis. And we just dealt with this with my dad, who had a similar lesion, and it did turn out to be cancerous. So when you got that diagnosis, I guess, how much did you know about valley fever at that point when they gave you the diagnosis?
I knew that valley fever was something that you could get in Arizona. And I knew that you contracted it from inhaling dirt. But basically, that dust that had the fungal spores in it, it's not communicable person to person or
Right.
animal to person. It's just dust. You're at more risk, obviously, if you're a hiker, which I am not, if you're a gardener, which I am not. And so I think it's not fair that I got it, but I know a lot of people that have had it.
Mm-hmm.
And typically when you have it, you have cold symptoms and then it just goes away. You don't even notice that you have it. It's not something that people typically go to the doctor for or even report because it's just not something that causes problems for most people. I do know, and I have heard of a lot of people, I guess I should say I have heard of like friends and family members of friends types of thing where they've ended up a lot more sick than that.
Yeah, yours is the first serious case I've heard of. Well, when I say serious, I'm the first one that ended in some level of surgical means. I have a close friend that lives in Arizona and has dealt with valley fever, but it was more like what you mentioned, a cough, cold-like symptoms that I don't know for specifically if she had medicine or not, but it went away through the normal course of life. So it sounds like your symptoms continue to persist even while you were on the antifungals.
They did. And so I've learned a lot about that now and what people need to do, but just as a way of sharing some education and statistics about this. So it is something that's in the southern United States. It's found in Texas, New Mexico, Utah, Arizona, Nevada, California. They found it as far north in California as San Francisco. The areas that really don't have a concern about valley fever is the coastal areas of Washington and Oregon. You're clear there. But the rest of the western United States does have some struggle with it, but there are areas where it's more likely to be, and it's called endemic or hyper endemic in those areas, and that's the southern United States that I just listed. Another thing that I think is really interesting to be aware of is that there are only 20,000 cases typically reported in the US of valley fever. Among those states that record it, only half of the states actually do record it, and it's something that's tracked and traced. But they estimate that the real case numbers are 20 times above that.
Makes
just
sense.
because it's not always something that someone needs to go to the doctor for or get help with. And then the last thing that I think is really interesting is that it causes 15 to 30% of community acquired pneumonia in Phoenix and Tucson. So that's in the Arizona area than larger cities. And so when they say community acquired pneumonias, that's what people are diagnosed with. It's not actually something that is, like I said earlier, passed from person to person. I was diagnosed with community acquired pneumonia twice, and that second time was when I demanded an x-ray and found out that it was much more than community acquired pneumonia.
Yeah, so you talked about, being put on these medicines, late last year, leading into this year, and then you've got the sort of the lead up to this summer where we started getting some text messages from you about things getting progressively worse. So, when you think about going back to when you were in the parks and starting to feel, like things weren't getting better, what caused you to decide that you needed to go back to get more care, if you will?
Yeah, so I had a CAT scan. One of the things that they do when they're following you for valley fever is they do regular CAT scans and visits with your infectious disease doctor. I had an infectious disease doctor, a pulmonologist, and I believe one other doctor, my general practitioner, and I think one other doctor, but I can't think of the type off the top of my head, that was following my case. And I was getting ready to meet with the infectious disease doctor, and he had requested a CAT scan before that meeting. The CAT scan came back, and the radiologist made a note that they were going to call the doctor directly with the results, but it had the readout of the results there as well. I did not understand the readout of the results because I am not a doctor.
Yeah.
I did put it into ChatGPT. ChatGPT did help me understand it a little bit. It seemed concerning to me. I did call my doctor 3 or 4 times before leaving for Disneyland because I wanted to make sure everything was okay. Radiologists don't often say that they're going to call your doctor if
Right.
you've gotten x-rays. Frequently, I've never seen that on an x-ray report ever, and I've had a lot of x-rays. So, and CAT scans. I was concerned about that. I called and left messages that I wanted to talk to the doctor. They kept letting me know that if the doctor didn't call me back, then clearly there was nothing to be concerned about with the CAT scan. So when your doctor tells you that you're okay, you believe it.
Sure. Right.
And off to Disneyland I went. I met a couple of our friends there. Molly and Marty were both there, and I had my daughter with me because we were going for Pride Night. Nothing was going to stop me from showing up for my daughter for that ticketed event at Disneyland. She looks forward to it all year long. It's a wonderful and amazing event. And so some of our friends were there as well, and they kept commenting, especially my last day there, that they could tell that I wasn't well. And thankfully, Molly kept pushing me to go see my doctor. I did have an appointment with my pulmonologist that following Tuesday because, it's just easier to wait for the scheduled appointment rather than going to the ER.
Yeah.
And that was when the pulmonologist said, you need to go to the hospital right now. That CAT scan is showing that you have a collapsed lung. So I had actually gone on a couple of trips with a collapsed lung, didn't know it, just kept pushing along thinking, why am I so tired? Why am I struggling to breathe so much? I'm in so much pain. Why? And just thinking that it was the valley fever and that I never considering that things were actually as bad as they were or getting worse. So I decided at that moment when she told me that I needed to go to the ER, to go to the Mayo Clinic. We're fortunate here in Arizona to have one of the 4 locations for the Mayo Clinic in the world here. They have the number one Mayo Clinic has the number one valley fever clinic. They call it the Coxsackie Clinic. The actual fungus is cocciol. I can't say it. It's very long. The doctors never say it either.
Mycosis. Yeah, it's a mouthful.
Yes. I've never heard a doctor even call it the real thing. They always just call it cocci.
Yeah.
So that might be another thing that you hear as if you ever encounter this, but valley fever and cocci. So it's the number one cocci clinic in the world. So I just said, I'm going to Mayo Clinic. And she said, well, I can't help you get admitted faster if you go to the Mayo Clinic. And I said, I don't care. I'm going to the Mayo Clinic. I already had an appointment scheduled with the Coxsackie Clinic there. And so I just went in. It was very quick. It was a very different experience from any hospital experience I've ever had. And that's where I found out that I had a collapse. Well, I knew I had a collapsed lung, but that it was because of the valley fever. It was because of the lesion on my lung that I had from the very beginning. Yeah. And they gave me choices after I got better. They had to spend some time healing my lung and trying to figure out what they wanted to do. I had a lot of teams coming in, a lot of students. I had a medical student write me a thank you note for being part of his journey just because I was a unique case. That's not something that they see all of the time. So that's where I went and where I knew that things were going to be different.
So you spent that time at Mayo and they advised you of, how serious things were. And I think that's when we started to get more information about it. How long before you started to realize that surgery was the likeliest path?
While I was in the hospital there and they were treating me for the collapsed lung, I had a lung tube that was draining all the fluid. I ended up being in the hospital for a week. And the infectious disease doctors said that they wanted me to have surgery, that the only way I was going to get better was to take this part of my lung that was now dead tissue, the cavitary lesion that was rather large out, because I was going to be more susceptible to lung collapses. And anytime I got a cold, it would hit that part of my lungs because it would be vulnerable and there would be nothing there to fight it, no live tissue to fight the bacteria there. So really what they told me is that this is the only way forward for you to have a healthy life. Was surgery. They really wanted it done then while I was in the hospital, but fortunately the way Mayo Clinic works, the doctors don't work on commission from the surgeries, the amount of surgeries that they do. They have salaries. And so it's a very different system. There's a documentary that Tom Hanks actually narrates about the Mayo system. I highly recommend it to everyone about the way their system works. I think it could solve a lot of healthcare problems in the US. But he said that I just wasn't healthy enough to do surgery. And that's one of the reasons that they kept me, was to see how rapidly I could get better and if I would be able to handle surgery. And they just decided that I needed to wait a month and see how things were going and see if I was healthy enough if I could get healthy enough to then do surgery in a month. And so that's what they did. I was hoping naively that I wouldn't need surgery and that I would miraculously be healed and that everything would be wonderful and all of the pixie dust would happen and I wouldn't need surgery and that everything would be fine. But that isn't what happened at all.
Yeah, no, definitely not. So you spent a month getting healthy, and this is where you and I ended up having a lot of conversations back and forth with my dad, just having been through a similar surgery for different reasons and determining, how invasive your surgery was going to be. And probably one of the most compelling things to me as an observer was that you essentially went into surgery not really knowing how serious the procedure was going to be and how invasive it might be, and that there were some options, and that the doctor would make those while you were on the table.
Yeah, 100%. There were options of the least invasive procedure, which was similar to what your dad had with robotics, where they were just going to cut out a small section of my lung, all the way up to very invasive, where they would make a larger incision and he would get in there with his hands, as he described it, to feel around and make sure that he got all of the dead tissue. And I ended up with something kind of in between a little bit. I mean, he didn't open me enough to get his hands in there. I did end up with a larger incision, about a 3-inch incision, plus the 3 spots for the robotics. And then they ended up taking out 2 wedge sections of my lung, and then part of my diaphragm, because the fungus had started infecting my diaphragm. And then there was an orange pill thickness. I hope this isn't too much detail and grossness. We should put an alert out for people. But an orange pill thickness of fungus all over my right lung. And so they did have to peel all of that off as well. When I was at the doctor this week, I told the assistant that I met with that the biggest pain that I'm having is feeling like I'm bruised from the inside. And she said, well, no kidding, because he beat the boop out of you with that robot while he was in there.
That's crazy.
So I guess that I felt validated in that moment, very validated that I was feeling the way that I was feeling. So yeah, so I ended up having to have a lot done and a lot taken out because of this fungus. And I think the takeaway for me, there are a few of those. Are we ready to go to takeaways, Ed, or do you have other questions leading up to that?
No, let's talk about takeaways from it. I think hopefully we can cover in takeaways the aftercare from a medical standpoint in terms of your prescriptions, because I think you've also had a journey there in terms of the pain pills and all that stuff, getting that stuff dialed in after you left the hospital.
Yeah, that's something that's really interesting too, is that while I was at Mayo the first time, I was really struggling with a lot of pain, and what they were giving me, it didn't make sense to them that I was still in as much pain as I was. So they actually ordered a pharmacogenic study on me where they take my DNA and look at the medications that will work for my body. They did it for pain medications, but they did it for a lot of other medications as well. And so there are a lot of pain medications that just do not work for me. And I had to go in. I was prepared to go in with a list. I put all of the results into ChatGPT just in case the nurses in the OR didn't get the memo from the doctors. Yeah. And so I had a list of what would work for me and what wouldn't work for me. My first nurse that I had did not believe me and did not believe that it was a thing, didn't know anything about pharmacogenic studies and what they were, what they did. Thankfully, she left quickly after I was out of surgery. I still had so much stuff in my system, and I wasn't very nice when she left. She said, I'm leaving now. I'm off duty. And I responded, good. And she said, I won't be back tomorrow. And I said, good. What I meant in my head was, good for you for taking a day off.
Yeah.
None of that came out. And I decided I don't even care because I'm in so much pain.
Yeah.
So the new nurse came on, and then everyone was very careful to follow that protocol going forward and making sure that none of the medications were on the list. I actually got to take when I left with a prescription for a brand new medication that was just approved in January 2025. It's a non-opioid medication. I call it Susie Jean. The real name is Suzetrigine. Juvanix, I believe, is another name for it. So it's a really great medication, and it has helped me a lot. And being non-opioid is amazing as well. So yeah, thank you for bringing that up, because I know that there are a lot of people that have procedures and surgery and struggle with pain and trying to get that dialed in and trying to stay away from opioids as well. So there are new options coming out on the market, which I think is great.
So what other takeaways do you have for folks having been through, and I can't even say that you're on the other side of it yet, but having been through most of this process at this point, what other takeaways can we leave with folks?
Yeah, I'm definitely not on the other side of it yet. My takeaways for sure are, if you ever have a cough for longer than 3 weeks, demand a valley fever test. If you live in or have traveled to any of those areas that are endemic, doctors often laugh it off. And I think even my doctor, it was never recommended for me ever, with as sick as I had been. That whole process, it was never recommended to do.
And based on where you live too. I mean,
yes.
If it was me living in Virginia, I guess I understand why valley fever doesn't pop to the top of the list if I don't give them a travel history.
Yes, 100%. But living in an area that is endemic, where it's such a problem for so many people, if I would have been given a valley fever test, it's a $55 test. That's it. That is it. A $55 test. In the very beginning, I could have avoided all of this. And so doctors, since it's not that common and people don't typically get that sick on it, doctors a lot of times will laugh it off. And I've heard of a lot of people that have been asking for valley fever tests. My hairstylist told me about one of her customers recently, actually, a different customer who was sick for 3 weeks, asked for a valley fever test. They laughed at her, but they gave her one, and it came back negative. She was sick for another week. She asked for another one, and that one came back positive. So it's really something to make sure that even if it comes back negative the first time and you're still sick, test for it again, because you can get false negatives with it. So the other thing is, if you know anyone that tests positive for it, or you test positive for it, demand that they test the levels of medication that they've prescribed to you to treat it, and make sure that it's therapeutic, because that's why I got as sick as I did, because the medication that I was on, they prescribed to me. And when I was in Mayo, one of the first tests they ran was to make sure that the levels of medication in my system, and they kept me on that medication long enough to test it to make sure that it was therapeutic, and it was not therapeutic. And so they had to change my medication and go a different route to make sure that I had therapeutic levels in my system of a medication that would work for me. And so I think that those are my two takeaways and advice that I would give to anybody that gets sick with cough that doesn't go away, or if you're ever diagnosed with valley fever. Those are my two takeaways.
Well, a few weeks removed from surgery, I guess the final closing question is, how are you feeling?
Yeah, I'm doing pretty well. I want to be back to my normal life last week. And so I am frustrated that I have to rest as much as I do. I'm getting a lot of shows watched, which I guess is fine because I'm not up to a cognitive load of doing anything besides just sleeping and watching TV, and that's totally fine for now. I am feeling better and better every single day, which is really good and exciting. Like I said earlier, I'm not on the other side of valley fever. I still have follow-ups with the infectious disease doctors, and I probably will for a long time. There is a chance that I might need to be on antifungal medication the rest of my life because you can't ever get rid of this type of illness. You can't ever get rid of the fungus inside of you because I learned from the doctors the fungus is actually DNA the closest to us out of anything like viruses, bacteria, they aren't, but fungus is, and that's why it's so hard to get rid of. And you can't ever totally get rid of it once you have it inside your body. And so it just sits there dormant, ready to activate and take advantage of any low immune instance that you have. And so there's a really good chance that I'll be on antifungals the rest of my life, which I hate them.
Yeah.
But it's okay. We'll figure it out.
There are lots of medical advances, so I will cross my fingers that one of them will be a better way to treat this for you and for others so that maybe you don't have to be on those medicines for the rest of your life.
Yeah. One of the exciting things that is coming in the next couple months is that there has been a test approved by the FDA for doctors in their offices to test for valley fever.
Oh, that'd be great, yeah.
So instead of having to do the $55 lab and having a whole procedure, they can actually just test it in their offices. So there are a lot of advancements coming. There is a lot of research. Mayo is on the cutting edge of all of that. I happen to have the doctor assigned to me that her name is on all of the research. So that's great for me and exciting. And I'm hoping that on the other side of this, when I am more healthy, I will be able to become some kind of an advocate somehow. I would love to see laws passed where if someone, is diagnosed with community-borne pneumonia, that a valley fever test is automatically offered to them. Like they don't have to take it, but at least offer that to them so that they can prevent sickness like what I've had and what I hear so many people suffer from.
Yeah, I definitely see efforts like that around the country. One of the cancer organizations that we associate with, do some fundraising with, called Pelotonia, they spearheaded a program in the state of Ohio. It's only state level because that's how so many of these things develop. But somebody there at the James Institute discovered a genetic precursor for a specific type of colon cancer. And so now if you're in the state of Ohio, because it is hereditary, if you're diagnosed with that strain of colon cancer, there's an outreach program in the state that will contact you and pay for testing for your relatives so that they can have early detection. And I think to your point on this, it's, as this science emerges, I think we'll see more of these types of things. But right now they really are grassroots efforts to get the word out on new tests. And it's sort of like, I liken it to like the internet before we had Google, and you sort of have to know what you're looking for. You got lucky to get a good doctor.
Well, in the end, I got lucky in the end to get a good doctor. If I would have had a good doctor in the beginning, I wouldn't be where I am. But
no, I agree.
And that's definitely why I'm speaking out about it, is so that other people can be aware and know what to look for and what to ask for and what to demand for from your medical team.
Well, I can't wait to see you back in the parks.
Yes,
catching you and me both at a castle when you're ready to be there, and you guys can be assured that we'll be bringing you more Disney-oriented content soon. This is definitely a unique episode and something that I did not think I'd be learning quite so much about.
Yeah, me either. Not something I wanted to. Definitely lots of Disney trips where I've been fighting this illness over the past year, really. So yeah, I'll be happy to be back in the parks again. I can't wait.
I can't wait. All right, well, until I catch you in the castle, I am Ed Pizza.
And I'm Steph Sweets. Catch us at the castle.